Hi, everybody. Today's lecture is going to be on heart and respiratory anatomy. We will be taking a look at both the heart models and some of the respiratory models. So let's go ahead and get started. So when we're looking at our heart, we have the main four chambers of the heart, and these ones are going to be your top two chambers, which are your right atrium and your left atrium. And looking at the inferior part of the heart, you can break down the heart to the right ventricle and the left ventricle. Notice there is kind of a marker, which are these two main blood vessels that kind of mark the division of your ventricles from the right side compared to the left side. Now looking at some of the blood vessels that are visible in this view, we have our main blood vessels on the left atrium coming into the left atrium from your lungs. Again, notice the color, these are red, which means they are carrying oxygenated blood. And because they're coming back toward the heart and basically dropping off blood in your left atrium, we refer to them as veins. And because they're originating from your lungs, we use the word pulmonary. So these two are left pulmonary veins. And it's not visible in this picture, but there are two that are coming from your right lung that are showing basically from this side. They come behind the heart and again, drop off their blood in the left atrium. Now, blood moves from your right atrium down to your, from the left atrium down to the left ventricle. And from the left ventricle, which is your pumping chamber, blood gets pumped through these largest blood vessel we have, which is called the aorta. Notice because the blood first goes up, this part is called the ascending aorta. It turns, forming the aortic arch, and then it basically allows the blood to go down into the abdominal cavity and then also supplying your lower limbs. So that part of the blood vessel is known as the descending aorta. Now, to make sure that your arms and your head and neck are also supplied with oxygenated blood, we have three main blood vessels that are coming off of your aortic arch. Starting from the right, you have brachiocephalic artery. The middle one is left common carotid artery. It's the one that basically goes up your neck. So if you're measuring your pulse using your neck, you're actually putting your hands or your fingers on the common carotid artery, on the left-hand side in this case. And then the last one that is branching farthest away from the arch of aorta, aortic arch, is your left subclavian artery, which is basically going to supply your arm, your left arm. Please do note, we will review this later on, but the brachiocephalic artery that we have here, if I continue to show the branches, you have one branch that's going up, which is the right common carotid artery, and the second branching of this goes over your arm, making your right subclavian artery. You will see that when we look at the blood vessel models for our future lecture. Now, when we take a look at the right atrium, there's two main blood vessels that come into the right atrium. So if you recall, we have one that collects from your, basically your thoracic cavity, and this is coming from the superior aspect called the superior vena cava. And again, in this view, we don't see it, but then there would be one from down here, which would be referred to as the inferior vena cava. Both of these are releasing blood into the right atrium. Now, blood from the right atrium, which is deoxygenated blood, moves down to the right ventricle. And from the right ventricle, this blood needs to be pumped into your lungs for the gas exchange to take place. So from the right ventricle, the main blood vessel that you see right here before branching, this is called the pulmonary trunk, which branches into two branches. Again, you only see one branch, which is the left pulmonary artery going to your left lung. But if you were looking at the view, there would be another one that would be poking right here, which would be your right pulmonary artery. Now in this view, you also see additional blood vessel associated with the heart supply of oxygenated blood and then picking up the oxygenated blood. So basically your coronary arteries and veins. So the main blood vessel that is visible here is basically originating from your aorta. So if you originate from aorta, it comes down and you see the branching happening right here where the left atrium is. So this branch is the one that is basically hidden and we can't see that, would be your left your left coronary artery. Now left coronary artery form two branches. So as it comes toward the left side of the heart, one branch is this large branch you see in front of the heart. And then you have one branch that is sitting and separating the left atrium from the left ventricle. Now look at the name of the branch that comes in front. It's called anterior, as I'm talking about the front, interventricular, running between the two ventricles, and it is an artery in this case, moving away from the heart. The second branch is going to circle around the heart and actually go to the posterior of the heart. So look at the name, circumflex, as in circumflex of a circle. So this is the two main branches. So if I say, what are these two main branches actually originate from? They're coming from the left coronary artery. And again, it's not depicted here, but it is a good piece of information to know. Now, parallel to your anterior interventricular artery, you have the main vein that collects blood from the anterior surface of the heart, and that is referred to as the great cardiac vein. Now moving on, looking at the posterior aspect of the heart. Again, this is a really good view because you can see the superior vena cava on the top coming into the right atrium, which would be right here. And then this is your inferior vena cava. And again, both of these are emptying into a space right here, which is the right atrium. Here in this section, you see the four main pulmonary veins. Again, these are your left pulmonary veins, and these two are right pulmonary veins, which we didn't show previously because it wasn't visible from the view of the model. Here, again, if you're looking at the front of the heart, you would have the pulmonary trunk coming up and then branching to these two blue lines you see right here. One is going to the right lung, so which you identify as right pulmonary artery. And this one that is poking up right here would be your left pulmonary artery. And again, this is another depiction of the aorta as an ascending aorta right here, aortic arch, and then you come back down as the descending aorta. Please do note the three branches again, brachiocephalic artery for the first one, immediately as the arch starts, followed by left common carotid artery, and lastly, left subclavian artery supplying the left arm. The other one that I haven't mentioned to you is the largest coronary vein we have in the posterior aspect of the heart is this one right here, which actually empties into the right atrium, and this is referred to as the coronary sinus. Here again, simplified version of what we looked at, right atrium and left atrium. Right here would be your right ventricle and left ventricle. If you guys want to kind of practice, the red one right here, even though it's not labeled, we know that is the anterior interventricular artery, and this one is your great cardiac vein. Here are your two pulmonary veins on the left-hand side. This is your pulmonary artery on the left-hand side. Here is your superior vena cava, aorta, aortic arch, and then descending aorta. And then you have brachiocephalic artery, left common carotid artery, and the last one is the subclavian artery. The three new structures that are depicted here are two blood vessels that are running on the right ventricle. They actually originate from this blood vessel. So notice where I'm running my pointer. This blood vessel is called the right coronary artery. And a couple of branches that comes off of it, one of the main one is the one you see right here in red, called the right marginal artery. And typically what we see is parallel to the right marginal artery, you have the blue one, which collects part of the blood from the right ventricle, and that is called a small cardiac vein. Lastly, the structure that's depicted right here is this connection you see between the pulmonary artery and aorta. This is called ligamentum arteriosum. This is a structure that we'll discuss in terms of fetal skeleton fetal circulation before. But basically what it is, it's because the pulmonary circulation in a fetus does not work, any blood that comes through the pulmonary trunk actually gets transferred to the aorta. So you don't have the pulmonary circulation in a fetus because basically they don't breathe. Now, when they are born, as they take their first breath and their lungs get activated, this connection starts to degrade, and eventually it forms a small ligament that is referred to as the ligamentum arteriosum. And then lastly, I forgot to mention that the pointy part or the peak of the heart is referred to as the apex. Now, looking at the interior structures of the heart, again, orient yourself first. Here is your right side, here's the left side. So we have the two chambers on the top, right atrium and left atrium, and then you have again right ventricle, which is even in the picture is very clear as smaller than your left ventricle. Now, the muscles that are lining the atrium are called pectinate muscle. The muscles that are lining the ventricles that holds the little tendons that keeps the valves open are called the papillary muscles. And the strings that are connected to the valves, your tricuspid or bicuspid valves right here, are called the chordae tendineae. So what are these valves that we're talking about? These two valves, which are right here, one in white on the right-hand side and one on white on the left-hand side, these are called your atrioventricular valve or AV valves. This one has 3 flaps, so they call it tricuspid. And the one on the left-hand side is called the bicuspid valve. You might also know it as mitral or mitral valve. So again, the strings coming off of it are chordae tendineae, and the basically securing of these chordae tendineae to the wall of the ventricles are done by these muscles called the papillary muscles. Now the heart muscle, which is the thickest layer around the left ventricle, it's called the myocardium. So you can see myocardium here, or you can see it right here. And then the separation between the right and left ventricle is done by what we identify as interventricular septum. This is also a path for the electrical impulse of the heart to spread through what we identify as bundle of His and bundle branches. So those are the only structures I need you guys to know for the heart. So moving on to your lungs. Sorry, I needed to see if I missed anything. So your lungs and your respiratory system, technically. We're starting with the nasal cavity here. So nasal cavity has these structures that are referred to as nasal conches, and they are present as the indentation within the nasal cavity with the goal of basically creating kind of air movement within the nasal cavity and cleaning any of the dust particles or harmful material that might be present within the air that you breathe. So their job is basically to filter the air by creating this kind of motion or movement of the air within the nasal cavity. Again, there are 3 of them. The top one is called the superior nasal concha, followed by middle nasal concha and inferior nasal concha. Now we have also a structure called basically the pharynx. So pharynx is simply used in layman's term is your throat. But for anatomy, we need to understand that pharynx is actually divided to 3 segments. We have the area that's behind the nasal cavity called the nasopharynx. Here is the oral cavity right here. So this is your oral cavity. So area right behind that would be oropharynx, which also present with tonsils. And the area that's closer to your vocal cord right here is the laryngopharynx. So if I'm identifying pharynx, just writing the word pharynx, it will not suffice. So you need to identify one of the three segmentations that are described here. Now, when you go farther down, and I'll have it in the next picture, you see these white lines right here. These are your vocal cords. And the structure that continues going down the vocal cords would be your esophagus, your trachea in front and the esophagus in the back. And this cartilaginous tissue, which basically is a flap of elastic cartilage, is referred to as epiglottis, that basically comes down and covers your air passageway and making sure the food takes the esophageal pathway rather than the tracheal path. Here is a similar concept. Again, you have your vocal cord right here. This flap in blue is your epiglottis, and the two tubes that are going down your neck, the anterior one, which is wide open, that's your trachea, and the one that is behind, it's more muscular and narrow, that's your esophagus. Now going down into the respiratory path, we have the different model here. So right here, starting from the superior aspect, we have the thyroid cartilage, which is this large cartilage protecting your vocal cords. And right on top of it, we have these bone. That's a bone we refer to it as the hyoid bone. A lot of the neck muscles have points of attachments to the hyoid bone. So hyoid bone is really important. Now, sitting inferior to your thyroid cartilage, we have this one right here that circles the vocal cord or the larynx. That's called the cricoid cartilage. And then if you follow that down, you see this blue tube or blue structure, I guess, with stripes of blue on it. That would be the trachea. So this is one view of the trachea, and again, this is the second view of the trachea, with the tube being anterior. So in this picture here, right, this structure would be your thyroid cartilage, and this one right below it would be your cricoid cartilage. And of course, you have your lungs. And the muscle you see right here down below, that would be the diaphragm, which is separating the thoracic cavity from what's underneath it, which is the abdominal cavity. Now, if you take a look at the lungs by doing basically a frontal cut of the lungs, what we do see is the trachea coming down further. And we have removed the heart, by the way, if you haven't seen or noticed that. Heart would have been sitting right here. That's why the structures here are not visible. Well, when we remove the heart, what we notice is that trachea branches. This branching is referred to as the primary bronchi if we're talking about both left and right. If we're talking about only one of them, it's called the primary bronchus. Now, if you follow this, you notice that the branching continues. So you have, as soon as the primary bronchi branches, you form what we identify as a secondary bronchus or secondary bronchi if we're talking about plural version of it. And this branching continues as you go down. You form your tertiary branches or tertiary bronchi. And the other structure which we can see here is the two color of the blood vessels. Please do note again, the blue ones, what we learn about the heart, the blue ones that are basically originating from the heart going to your lungs are your pulmonary artery. And the red, which is picking up picking up oxygenated blood from your lungs, those would be your pulmonary veins. So if you have that idea that the red is going to be always arteries and blue always going to be veins, that is basically reversed in part of the circulation associated or in circulation associated with your lungs. So different view. Now we have a better view of the structures, kind of looking down at it. We have the blue structure, which is protecting your vocal cord. That's your thyroid cartilage. This one didn't depict the cricoid cartilage, but it would have been sitting right underneath. The butterfly gland right underneath the thyroid cartilage, right here is the thyroid gland, which is wrapped around the trachea, you see in blue. Again, trachea is branching to the primary bronchi, secondary bronchi, and continue forming tertiary. The other branching are not depicted on the models, they are smaller, and again, these models lack that detail for us to see. And of course, at the end, things like respiratory duct or alveoli, these are microscopic structures. So of course, they're not going to be visible on the gross anatomy model. Now, please do note that on your left lung, you have this very pronounced indentation. This is where the apex of the heart sits and is referred to as the cardiac notch. Here is the lung picture again. The point for us to see this is we want to know that the lungs is divided to 3 lobes on the right and 2 lobes on the left. So if you're talking about the right side, you have the superior lobe, you have the middle lobe, and you have the inferior lobe. And then on the left-hand side, you only have the superior and inferior. There is only 2 lobes on the left-hand side because of the presence of what we identify as cardiac notch, making your left lung smaller. We're going to finish by taking a look at the paranasal sinuses. We have discussed this in terms of a skull previously, but it is a good review for you guys to connect it to the proper system. So we have 4 sets of sinuses. Their name comes from the bone they're associated with. So if they are located on the forehead, which is basically your frontal bone, they're called frontal sinus. Going down right underneath the internal bone called the ethmoid bone. So these red structures are your ethmoid sinus, which is depicted right here. We have the butterfly-shaped bone that is basically forming the arch inside of our eyes or inside of our skull, which is our cranium. These are associated with the sphenoid bone, so called the sphenoid sinus. And then we basically have bones inside our, and we have sinuses inside our maxilla, which are called the maxillary sinus. So that's about it, guys. So review this, and then you, of course, have the homework assignments on Canvas. So please complete that and turn it in by the due date.